Do you feel like your arm is a bit weak this morning? One side of your face is drooping a little? Thinking maybe it's due to sleep or fatigue? Stop. This might not just be fatigue. This could be an urgent signal from your brain, a mini stroke, which is a precursor to a major destructive stroke in the future. Did you know that in 40% of cases where people ignore the symptoms of a mini stroke, they have a major stroke within the next 3 months? Even more terrifying is that nearly 80% of mini stroke patients don't go to the hospital because they didn't even recognize the problem. Today's video could change your life or that of your parents or grandparents. Don't skip it. Watch it now for future protection. Welcome everyone. Today's video is specially made for people aged 50 to 80 and their family members. Don't think of this as just another health tip. This is emergency life-saving information. A mini stroke, or in medical terms, transient ischemic attack or TIA, is a temporary disruption in blood supply to the brain. The symptoms come and go within 24 hours, and this going away is the biggest trap. People think it's gone, no problem. But in reality, it's a red light from your brain, a final warning that there's a problem in your blood vessels that could soon lead to a major stroke. In this video, we'll cover not just the symptoms, but why it happens, how to identify it, and most importantly, what to do. This knowledge won't just make you aware, it could potentially save your loved one's life. Let's get started without wasting time. Before that, please subscribe to the channel to encourage us, and don't forget to comment with your thoughts. As always, we'll first learn about the causes of why this happens. So, without further delay, let's begin. Cause 1. Plaque buildup in blood vessels and atherosclerosis. This is the main cause. With age, cholesterol, fat, and calcium build up on the walls of our arteries, forming plaque. This narrows and stiffens the blood vessels. If a small piece of plaque or a thick part of blood, clot, breaks off from this narrowed area, it can travel with the blood and get stuck in a small blood vessel in the brain. As a result, blood and oxygen supply to that area stops, leading to a mini stroke. Smoking, high cholesterol, and high blood pressure accelerate this process. Cause 2. Uncontrolled high blood pressure. High blood pressure is called the silent killer. It constantly puts pressure on the blood vessel walls and causes damage. This damaged wall makes it easier for plaque to build up and increases the risk of vessels bursting or blood clotting. High blood pressure directly damages the brain's fine blood vessels, making them prone to blockage. Cause 3. Irregular heartbeat. If the upper chambers of the heart, atria, don't beat properly and instead quiver irregularly, blood can pool there and form small clots. These clots can easily escape from the heart and get stuck in the brain's blood vessels. This is a very common cause among older adults. Cause 4. Diabetes. Long-term uncontrolled diabetes makes blood vessels weak, thick, and brittle. High blood sugar is harmful to the health of blood vessel walls. It greatly increases the tendency for plaque buildup and blood clotting in the vessels. If you have diabetes, the risk of a mini stroke increases by 2 to 4 times. So we've learned all the causes. Now let's learn about those 8 symptoms and at the end, what to do if you see these in yourself or someone else. Symptom 1. Face drooping or sagging. When asked to smile or show their teeth, one side of the face moves normally while the other side doesn't move or droops. One eyelid might not close properly, drinking water might spill from one side. You can ask the person to smile. Is the smile even on both sides? Symptom 2. Weakness or numbness in arms or legs. One side of the body, right or left, suddenly feels weak, heavy, or numb in the arm or leg. The person might not be able to lift their arm, or if they do, they can't hold it steady. They might drag their foot while walking. You can ask them to raise both arms in front and hold for 10 seconds. Is one arm drifting down? Symptom 3. Slurred speech or difficulty understanding. Suddenly, trouble speaking. Speech becomes unclear, slurred, or stuttered. Words might get jumbled or the wrong words might be used. There could also be trouble understanding what others are saying. You can ask them to say a simple sentence like, "The sky is very clear today." Are they saying it clearly and correctly? Symptom 4. Sudden vision problems. Sudden blurriness, darkness, or complete loss of vision in one or both eyes. It might feel like a curtain has fallen over the eye. It returns to normal after a while. Double vision can also occur. You can ask, can you see clearly? Is there any blurriness or black spots? Symptom 5, dizziness, loss of balance. Sudden intense dizziness, difficulty standing or walking, inability to maintain balance. It feels like the world is spinning. This is much more intense than ordinary weakness or dizziness from sitting up. This symptom is often mistaken for vertigo, but in many stroke cases, it usually comes with other symptoms like weakness or slurred speech. Symptom 6, severe and unusual headache. The worst headache of my life, that kind of feeling. It starts suddenly, without reason, in a completely healthy state. It might not be like a migraine headache. This is usually related to a hemorrhagic transformation or vessel rupture, which is even more urgent. Symptom 7, changes in sensation. Sudden, unusual sensation on one side of the body, like cheek, arm, thigh. Tingling, pins and needles, numbness, or even pain. It might feel like you can't sense touch in that area. You can check if light touch or a pinprick feels the same on both sides. Symptom 8, confusion, memory loss, or difficulty understanding. Sudden temporary confusion, loss of ability to understand simple things, difficulty figuring out where you are or what's happening, inability to make small decisions. You can ask them to recall recent events or names of familiar people. As soon as the symptoms of a mini stroke appear, call your local emergency number for an ambulance and don't try to drive yourself, as the patient's condition could worsen en route, and ambulances provide initial treatment. Even if the symptoms go away, going to the hospital is mandatory. At the same time, note the time symptoms started, type according to FAST formula, duration, patient's previous illnesses, and current medications, which will help the emergency doctor make quick decisions. Then, at the hospital, quick physical and neurological exams, CT scan or MRI, ECG, echocardiogram, carotid ultrasound, and blood tests will be done for evaluation. Finally, follow the doctor's advice to start blood-thinning medication, cholesterol-lowering drugs, statins, strictly control blood pressure and diabetes, quit smoking and alcohol, and attend regular follow-up visits to lower the risk of further attacks. Understanding the mechanism of a mini stroke makes its danger clear. Imagine a specific area of your brain gets oxygen and nutrients through a small blood vessel. Now, for some reason, there's a temporary blockage in that vessel, a clot, piece of plaque. The cells in that area can't survive without oxygen. Symptoms appear. But our body has its own mechanism. Maybe the clot breaks up or blood supply starts through another route, collateral circulation. So the cells are saved from dying and symptoms disappear. But that's not the end. The problem is that the cause of that blockage, perhaps a narrowed blood vessel or clotted blood from the heart, still remains. This could indicate a shift from a stable plaque to an unstable one, which could block again on a larger scale at any time. Then, those cells will die permanently, leading to paralysis, loss of speech, or memory loss, a full stroke. A study showed that after a mini stroke, the risk of another stroke is 5% in the first 2 days, 10% in the first month, and 15% in the first year. But proper treatment and lifestyle changes significantly reduce this risk. This is nature's last warning. Accepting it and taking the right steps is the wise thing to do. The 8 symptoms we discussed today aren't just a list, they're a life-saving toolkit. Keep this knowledge in your phone or in the corner of your mind. Share it with your parents, uncles, aunts, neighbors, everyone. Because a stroke doesn't give advance notice. It can strike anytime, anywhere. If you or your loved one's age is over 60, start being aware from today. Check blood pressure and diabetes regularly. Eat healthy food, walk a bit, stay away from smoking. But most importantly, recognize these 8 symptoms and never ignore them. Remember, your body is the most valuable. A little awareness can ensure a healthy, active, and joyful old age. If today's video can save even one life, our efforts are worthwhile. Stay well, stay healthy, stay aware. And don't forget to share this important information in your circle. Thank you.